Welcome. I am Dr. Cian Davis, and I'm here to share how and why I screen women of all ages for interpersonal violence. At no time in the new millennium has it been more important to prevent interpersonal violence, which also includes child maltreatment and elder abuse. Intimate partner violence is the most common form, with a lifetime risk of victimization of about 1 in 3 women and 1 in 4 men. 16%, or about 1 in 6 U.S. homicide victims, are killed by intimate partners. Survivors commonly sustain physical injuries, a rate of 41% for female survivors and 14% for male survivors. This is the Preventive Services section of the Women's Preventive Services Initiative Well Woman Chart, which is updated yearly. As you can see, WPSI recommends at least annual screening of all adolescent and adult women for interpersonal and domestic violence. Victimization may be physical, sexual, stalking, or psychological, including coercion or reproductive coercion, neglect, threat of violence, or threat of abuse. Recommended care includes referral for initial intervention and support services such as counseling, education, harm reduction, or other strategies. On the same website, the clinical summary tables remind us that, although all women are at risk, factors such as young age, substance abuse, relationship problems, and economic difficulties elevate risks. Here are some practical details of screening for interpersonal violence during visits. Include screening questions in general self-screening forms and electronic medical records. Normalize routine questions during staff and provider verbal history taking. Use validated brief screening tools. Most include only 3 to 5 questions. Choose 1 or 2 tools that you are comfortable with. Include some one-on-one time if possible to allow private disclosure. Know local resources for referral and rescue and have numbers and brochures in bathrooms and exam rooms. Be prepared. Patients may seek shelter directly from your office. Disclosure may require multiple attempts and visits, and patient history may change. Please be sensitive to and respect language and cultural variations. This website includes a table of sensitive and specific validated screening instruments, such as those mentioned on this slide. This psychosocial screen, part of an American College of Obstetricians and Gynecologists standard obstetrical medical history form, is based on the Florida Healthy Start prenatal risk screening form. Key questions related to interpersonal violence are included. Keep in mind, adult abuse experience or adverse childhood events, including observing abuse or being directly abused, may underlie a variety of behavioral, physical, and mental health presentations, such as obesity and inactivity, substance abuse, sexually transmitted diseases, depression and suicide attempts, heart disease and stroke, missed work, fractures, or other conditions. The remaining slides include useful references from the American College of Obstetricians and Gynecologists, useful links, and patient resources, both for telephone and internet. That concludes this video. Thank you so much for joining me today.